Hi, welcome back to my channel. Today I'll be talking to you about 5 important points everybody and everyone must know about these points during this COVID-19 situation. Nowadays what's happened is the COVID-19 virus has become more infectious than less fatal. It's not that dangerous, but it's become very infectious. COVID-19 was initially thought to cause death due to pneumonia, a lung infection. So ventilators were thought to be the best way to treat sick patients who could not breathe. Now we are realizing that the virus causes blood clots in the blood vessels of the lungs and other parts of body, and this is the cause for the reduced oxygenation. Now we know that just providing oxygen by ventilators will not help, but we need to prevent and dissolve the microclots in the lungs. This is why we are using drugs like aspirin and heparin, that is blood thinners that prevent the clotting. Previously, patients used to drop dead on the road or even before reaching a hospital due to reduced oxygen in their blood. That is oxygen saturation. This was because of hypoxia, where even though the oxygen saturation was gradually reducing, the COVID-19 patient did not have any symptoms until it became critically less, like sometimes even 70%. Normally, we become breathless even if oxygen saturation reduced below 90%. This breathlessness is not triggered in COVID patients. So, we are getting sick patients very late to the hospital in February 2020. Now, since knowing about hypoxia, we are monitoring oxygen saturation of all and getting them to hospital if the oxygen saturation drops to 93% or less. This gives more time for doctors to correct the oxygen deficiency in the blood and a better survival chance now. Third point, we did not have the drugs to fight the coronavirus in February 2020. We were only treating the complication caused by it, that is hypoxia. Hence, most patients became severely infected. Now we have 2 important medicines, as you've seen in newspaper, that is favipiravir and remdesivir, and which are antivirals and that can kill the coronavirus. By using these 2 medicines, we can prevent patients from becoming severely infected and therefore cure them before going to hypoxia. This knowledge was not available in February 2020, but now we are aware of it. Fourth point you must know is many COVID patients died not just because of the virus, but due to the patient's own immune system responding in an exaggerated manner called cytokine storm. This stormy strong immune system response not only kills the virus but also kills the patient. In February 2020, we did not know how to prevent it from happening, but now we are aware that easily available medicines called steroids that doctors around the world have been using almost 80 years can be used to prevent this cytokine storm in some patients. Now we also know that people with hypoxia become better just making them lie down on their belly, known as prone position. Apart from this, a few days ago, Israel scientists have discovered that a chemical known as alpha-defensin produced by patient white blood cells can cause the microclots in the blood vessels of the lungs, and this could be possibly prevented by a drug called colchicine, used over many decades in the treatment of gout. So now we know for sure that patients have better chance of surviving the COVID-19 infection. India has not peaked in March or April because of lockdown. The strategy has postponed the COVID-19 pandemic in India by 3 crucial months that has enabled us to save thousands of lives. Going forward, there's nothing to be panic about COVID-19. Only if you remember that the following precautions we have to take. That is 6 feet distancing from others, wear proper mask, and work from home wherever possible and order from home delivery of food, groceries and vegetables. Hand wash and hygiene is very important. And most important thing is, if you lie down on your stomach, there is more oxygen flow to your lungs, so breathing will become easier. If you feel this information is valuable, please share. Let the people be aware of this knowledge. Share with your friends in community. Let's make the community panic free and COVID free.